I have a 10 years old girl in that's lying and has been referred, or you can say that the complaint is that she is having PUO for the last 3 months and has been taking medicines for the last 3 months. This is the first ultrasound that she has been referred for ultrasound to rule out any pathology if we can by ultrasound. And no clinical or laboratory investigative procedures have been provided. She belongs to lower class socioeconomic group, and which is very common in our society. Patients are neglected, and that's the reason that after 3 months she has been referred for ultrasound. Now let's see what we get. We start from the liver. Okay. You see that I am getting the liver tissue below the costal margin. The liver is enlarged. This is the liver tissue that I am seeing below costal margin. This is the right kidney in transverse section. This is the hilum. And this is the diaphragm. Now, when I try to expose the diaphragm in total, I see that there is no fluid above the diaphragm that rules out any evidence of pleural effusion as a cause of PUO. So there is no fluid above the diaphragm. Kidney is normal. Comparing the parenchyma of the kidney with that of the liver, it's seen that this is the right kidney, the upper fold, lower fold, the central sinus echo complex, the pyramids, this is normal. This is the liver, diaphragm. So up to this point, it's all fine. Now this is the gallbladder. This is the gallbladder. Gallbladder is normal. This is the portal vein. And if we see that the hepatic veins are not dilated, neither is the heart. This is the subcostal view of the heart. There is, here we come to the IVC. Now the IVC is clear, and normal caliber. This is the caudate lobe of the liver, this one, because it is bounded anteriorly by ligamentum venosum and posteriorly IVC. Here I am seeing both right portal vein and left portal vein together. This is the main portal vein at the region of the porta hepatis. I'm magnifying a bit. Now, this is the portal vein. It's of normal caliber, 6.5. This is the IVC. This is the liver. So now this is the portal vein, this is inferior vena cava, and that this area is the head of the pancreas, this area. This is the head of the pancreas. This is the body of the pancreas. You see, this is the splenic vein, this one. This is the splenic vein, superior mesenteric artery, and This is the superior mesenteric vein. This is the gallbladder, liver, and this portion is the body of the pancreas. So the pancreas is normal, and the central echogenic line within this is the pancreatic duct. See that the pancreas is relatively, parenchyma of the pancreas is relatively hypoechoic, because in this age group the pancreas is less echogenic compared to that of the liver, provided the liver is normal. Now the liver is not normal. It is showing in prominent portal veins, minor portal vein radicals. They appear as starry appearance. They are giving starry appearance. Stars in the sky behind black background of the parenchyma due to infective changes and fluid. These radicals are of significance. We will say that the parenchymal echogenicity of the liver has gone down significantly, and that is the reason that we are seeing the minor portal veins so prominent. In normal cases, we don't see the minor portal veins. They are starry appearance. So liver is enlarged minimally. I am seeing below costal margin, its parenchymal echogenicity has gone down. The minor portal vein radicals are very prominent, and let's see if there is any lymph node at the region of the para-aortic region as a cause of PUO. This is the superior mesenteric artery, celiac artery, the aorta, and we don't see any lymph node in this region. No lymph nodes, at least in this region, no pleural effusion, and so this area is clear, except the findings that I have just narrated. Now, what is the splenic size? Is there any pleural effusion on the left side? Now, this is the spleen. This is the spleen. This is the left hemidiaphragm. There is no fluid anterior to the diaphragm, above the diaphragm, sorry. So there is no pleural effusion. Here we see kidney now. But here, this is the kidney, the left kidney of this child. And here we are, this is the kidney which is normal. And as we know, this is the left kidney. And as we know that the kidney glides over the psoas major muscle. So where is that muscle? Let's see, where is that muscle? Now instead of the muscle, we are seeing a tubular structure with marginal echogenicities. Now this is the left kidney. This is the spleen. This is the splenic tissue. Now this tubular structure, this area, having echoes here, this is sand-like particles within it, and these are the non-shadowing echogenicities, and these are seen more significantly prominently at the edges of the anterior and posterior wall of this cystic, longitudinal cystic area that extends from the posterior medial aspect of the left kidney and extends down up to the left adnexa, left pelvic region. This is the urinary bladder. This is the dorsal section. This is the urinary bladder in longitudinal section. So as such, the pelvis is unremarkable. You don't see any findings. This is the uterine bud, this area. This is the uterine bud. And here. If you see that I am here now, and I can see the lower part of the lower end of the tubular structure, and when I move the probe in this direction up to this level, in this direction, the tubular structure persists from here down up to the left side of the pelvis. Now let's see on the ultrasound machine. You see, this is the urinary bladder in longitudinal section. These are bowels giving dirty shadow, and this is the lower edge of lower margin of the cystic area that is under study. Now I'm going upwards, and you just see that magnifying, same, going upwards as I showed you, and you can see that left kidney is gliding over. See the movement of the left kidney. This is the left kidney, and you can see the movements that it is gliding over this cystic area. Now this cystic area is in fact there, and you don't see any muscle in this region. Where is the source muscle? So this is in fact left source abscess, and if this left source abscess is the cause of her PDO for the last 3 months, and so this is the left kidney, fine, and this is the fluid collection. This is fluid, pocket of fluid extending inferior-medially up to the left pelvic region. This is fluid. This is all collection, and this is how a source abscess will appear to you. Now this is see, there are echoes in this. I will have to magnify to make it clear. Yeah, marginal calcifications. You can see these are marginal echogenicities, and you can see these sand-like particles within this tube, flexion, flocculated fluid area. Now this fluid is in fact pus. This is the kidney, and you can see that these sand-like particles, these areas, this is clear plaque area, and here you see the echogenicity as well as the low-level internal echoes, this debris. And see that there are multiple, numerous echogenicities with the wall of the anterior and posterior wall of this cystic area. So this is now this cystic area being an abscess is has gone sterile, in fact, because he has been taking heavy antibiotic for the last 3 months. That has made this cystic area as being sterile. Why? Because we are not seeing that much of these echoes, the internal echoes or the pus. Otherwise, the abscess gives the appearance of this area. As you are seeing in this region, the abscess pocket usually gives the sonographic appearance consistent with this region. Now it's being clear, having echogenicities at the margins, major portion being clear internally is because of the sterility produced by the a lot of antibiotics used by this young girl for the last 3 months. So this is a study of how we study nuclear fusion. This is spleen. Is the spleen enlarged? Is also important to note. In all cases of PU, so the spleen is not enlarged, measures 10.4. Normality is up. Normal is up to 12 centimeters. So taking these together, spleen. This is the spleen. This is the left kidney. This area is the left kidney. And this is the psoas abscess. And these are the echogenicities. This is the echoes within it. No psoas muscle is seen. It is seen in the region of the psoas muscle. The kidney glides on this cystic area. So this is a case study of PU, and the cause that we have depicted by ultrasound is the left psoas abscess. Thank you.